San Juan, Puerto Rico after Hurricane Maria ravaged this island, leaving most hospitals here without reliable power. The U.S. Navy sent a massive floating hospital to help fill gaps in the fragile healthcare system. Hardly anyone has used it. The USNS Comfort, a 70,000 metric ton ship staffed with roughly 800 medical and support personnel and 250 beds, has treated only about 150 people since it arrived on October 3, said a U.S. Navy spokesman aboard the vessel. It costs about $180 daily to operate the ship. According to the Navy, Comfort service members said they initially feared demand would exceed their capabilities. Now they are frustrated they aren't doing more, said Capt. Kevin Robinson, mission commander. He said he reminds his staff there is no doubt that some of those patients they've treated wouldn't be alive today if we weren't available. Get fresh news and exclusive analysis on politics, policy, national security, regulation and more, delivered right to your inbox. Hurricane Maria, a Category 4 storm, slammed into the U.S. Commonwealth of 4 million people on Sept. 20 with sustained winds of 155 miles an hour, killing nearly 50 residents and leaving 250,000 without homes. Critical lifelines, telecommunication links, power, and roads were lost or severely compromised, shutting down hospitals and access to impacted communities. Government officials say Puerto Rican hospitals are aware the Comfort is ready to take in critical patients. But if Dr. Felix Valle-Avalos is an example, few know about it. Dr. Valle-Avalos, who works at a community health center and a walk-in clinic in Arecibo on the island's northwest, said he hadn't received information about the ship or how it can be used. Patients who show up at the Comfort aren't turned away, but the normal path is through San Juan Centro Medico Hospital, where doctors evaluate requests for transfer from other hospitals. Contact the Medical Operations Center, which in turn dials the ship. Patients are flown to the vessel via helicopter from other hospitals. To slice through some bureaucracy, officials recently changed the protocol to allow regional hospitals to contact the operation center directly, said U.S. Army Colonel Jose Garcia, who oversees medical coordination for the U.S. Department of Defense's relief efforts. Patient numbers have gradually climbed in recent days. The DoD also stationed personnel outside of hospitals around the island with satellite phones to relay information about hospitals' power, water and patient count, in case there was need to evacuate or transfer patients, said a U.S. official. 4 U.S. Army crews were recently certified to land on the ship during daytime, increasing the ability to transfer patients, said a Navy spokesman. Still, U.S. emergency officials say the ship has been a valuable backup for the island's nearly 70 hospitals, about a third of which are reliant on generators that offer spotty power. The ship houses surgeons, pediatricians, an obstetrician, X-ray machines, a pharmacy and even a dental suite in hard-hit Humacao, in the east of the island where Hurricane Maria made landfall. Ryder Memorial Hospital closed after one of its generators failed, according to Jamie Place Courts, the executive president of the Puerto Rico Hospital Association. The October 4 power failure prompted the evacuation of 29 patients by helicopter to San Juan, where 5 were transferred to the Comfort, according to federal health and defense officials. 2 days later, the Comfort took in 4 patients after generators failed at Hospital Menonita in Caguas, south of the capital, as it has moved along Puerto Rico's north coast. The ship has also supplied hospitals with more than 10 tons of food and water, plus 100 liters of oxygen. The island's oxygen-producing plants were badly damaged in the storm. leaving many patients scrambling. Angela Magaa, 34, who visited the Comfort on October 4 while it was docked in San Juan, said she was able to get treatment for her anemia on the ship after another healthcare provider told her she would have to wait months for an appointment. However, she said nobody in her neighborhood had known about the ship and she learned about it from an acquaintance. On October 17, the Puerto Rico Department of Health tweeted out a picture of the Comfort, along with a hotline patients can call for information about health services, including the hospital ship. The hotline was meant to answer health-related questions and alert patients that Comfort wasn't an outpatient facility. According to Carlos Gomez, who oversees the emergency room at Centro Medico, the ship is meant for the critically ill. He said, with less than half of cell phone towers working, communication remains a problem for parts of the island. Local officials have also tried to get the word out about the ship through more rudimentary and primitive methods, including radio and word of mouth. Dr. Gomez said, write to Daniela Hernandez at wsj.com.